Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Gargi Raut. Our top focus today is the United States, which has reported more than 900,000 COVID cases in a week, with the country representing 20% of global cases, a sign the pandemic surge caused by the Delta variant has stalled the progress made by an aggressive vaccine rollout that dampened cases this spring and summer. What's worrying is also the number of children hospitalized in the United States is now at a new pandemic high. You're also seeing more cases among the unvaccinated, and that is the big worry, this vaccine hesitancy that is being seen, especially in the southern states. Well, to talk more about the situation in the U.S., we're joined by Dr. Eric Fiegelding, epidemiologist and health economist. Thank you so much, Doctor, for joining us on the program. Now, there are predictions that case numbers in the U.S. could hit 200,000 in a day. This has been devastating, and there have been many missteps as well in the U.S. policy.
Yeah, the U.S. is definitely seeing a huge surge. I don't need to tell you, of course, in India how bad the Delta variant can get. But in certain ways, many people in the U.S. got complacent because they thought we have large vaccine rollouts, more than half the country is fully vaccinated, we should be fine, what happened in India won't hit us. They were obviously very, very wrong. And I've been saying this for quite a while, that people have really let down the guards. They thought the pandemic was over. They dropped their mask. And now, after the CDC said you don't have to mask, you're vaccinated, they clearly were wrong. And walking back a mistake is trying to put the toothpaste back in the tube, which is almost incredibly hard. And now we have record hospitalizations among kids that we did not see previously at such a high levels. And hospitalizations are definitely like almost more than half the winter peak. So the U.S. is definitely in trouble because right now there's even less healthcare workers and even less testing than before. So I think it's very confusing times. And I think with schools about to open nationwide, already open in many parts of the country, it will even continue to get worse.
In fact, that was going to be my next question about children. You're seeing reports of more children being affected this time around. Is it different than compared to the earlier wave, or is it just because the sheer numbers are high?
Yeah, that's a good question, because there's two ways you can have more sick children. One is that if it's more infectious, by infecting more people, you are enlarging the number of exposed, and then, of course, there will be more children sick. But I think there's two things here. Delta variant is, now we know, it's 1,000 times greater viral load upon the first test. And the test is also about 2.5 days faster than previously. Previously, on average, the median infection time from exposure was about 6 days until a positive test. Now it's 3.5 days. And upon that 3.5 days, it's 1,000 times higher viral load. So it's a much stronger, more infectious and much more virulent, severe virus. And we see the data that clearly shows out of Singapore, the UK, out of Canada, that it's about 3 to 5 times greater risk of hospitalization. So given that and the viral load, I think it's pretty clear that it is both. More kids are infected because it's twice as infectious, and it is much more severe. Hence, sick kids get more sick. And that creates a perfect storm because it's the worst of both worlds.
And what do we know for sure about the Delta variant? You spoke about it being more infectious, more severe. After the devastating second wave that we saw here in India, we were sure it was a lot more infectious. There were still more studies required to know if it was more severe.
Yeah, we have these studies now. We didn't back when Delta variant first surged in India, but now we do. In Singapore, we've seen it. Singapore found 4.9 times greater risk of hospitalization, ICU, and death compared to the old strain. In the UK, they found 2.5 times roughly greater risk of hospitalization than the Alpha B117 variant, which was already stronger than the original, which makes Delta about 4x, again, greater severe risk of hospitalization. So we've seen that in the viral load studies. And the more important thing is now that caught CDC off guard was that it actually has high rates of breakthrough infections. And it creates more asymptomatic infections. In certain ways, a vaccinated person's asymptomatic infection is actually quite dangerous, not because it gets the vaccinated person sick. A vaccinated person is still protecting 90% efficacy against hospitalization. But it actually means that if you're asymptomatic and you're vaccinated, you will live a much more carefree, cavalier life, and it will actually allow you to go to more indoor settings without any knowledge that you're carrying the virus, and it will allow you to spread the virus even further. In certain ways, the silent nature, the asymptomatic nature of the coronavirus is what's so dangerous. And now vaccinated people can transmit. Now they get the infection less, about 3 times less, but if they do get it, the first 6 days, their viral loads are equal to an unvaccinated person if infected. Again, low risk, but again, they are still transmitting the virus, and oftentimes without symptoms, which means that there's very little contact tracing, very little testing, and the virus will continue to spread.
And give us more details of what we've learned about these breakthrough infections. What has the experience been in the vaccinated areas, unvaccinated areas? You have a big difference you're seeing in areas where people are less vaccinated.
Yeah, the U.S. has many problems right now with vaccine hesitancy for sure. A lot of the conservative areas, the Donald Trump supporting areas, they don't vaccinate and don't mask. They don't have mask mandates, and they don't isolate. They have much more open indoor dining, relaxed rules, and that creates a perfect storm. And of course, even in the more liberal areas that vaccinate more, higher rates of vaccinations and mask wearing, the issue is the Delta variant is growing slower, but exponentially slower is still exponential. It's just a slower exponential. Eventually, given enough time, the Delta variant will surge there too. And we're seeing that. We are seeing that it's going up even in the vaccinated areas because the Delta variant is just so contagious. And as mentioned, a lot of vaccinated people, they're 3 times less likely to catch the virus. But if they do catch it, 1/3 of the risk, the first 6 days they have the equal viral load. Now, a vaccinated person, further, their viral load drops faster, but the first 6 days is oftentimes when you're most infectious. Again, it's about 3 days faster, right? 2.5 days faster. So this is where the risk is. This is where we're in this pickle where you have a vaccine that works, but not enough people take it. We're now thinking you need 90% for the herd immunity, given how leaky it is. And, we have children not even eligible yet, so getting to 90% of the total population is really impossible at the current stage, even if you have vaccines.
Right, and if we talk about the world situation, vaccine equity is a huge challenge right now. In India, we are trying to vaccinate as fast as we can, but still our levels overall are very low. Of course, absolute numbers are extremely high. You just spoke about herd immunity and how what experts think about that has also changed, and the fear, that constant fear of more variants emerging.
Yeah, the variant will continue to emerge anytime there's unchecked spread. Unchecked spread is anywhere there's not enough vaccines, or there's vaccines but people don't take them enough. U.S. is 50% overall. You have states that are 70% vaccinated, and you have states that are 25% vaccinated. That's how you get the 50%. But you have literally 2-3-fold difference in vaccination rates between many parts of even the U.S. And of course, the world, the disparity is even larger. The low-income countries, the low-income countries, we're we're still in the single-digit percentage vaccinated. And so that will continue to breed COVID. And what used to maybe protect people enough, people say, some background immunity will not be enough, given that it's 1,000 times higher viral load and much greater risk of reinfection. So even if there's been a previous wave, and some people say we're at a natural infection herd immunity. No, that's been said like dozens of times, and people have been wrong dozens of times. COVID is not over, And we have to get realistic that we need not only vaccines. Vaccines work, but we need vaccines plus masks, premium masks, and ventilation standards of indoors. Because indoor unventilated areas are a perfect storm for super spreading things. And if we don't revamp our society and our buildings to have these new standards, then the virus will keep spreading and new variants will emerge. And I really worry about what is the next variant, because Delta variant has already clearly surpassed every other variant, has caused the extinction of all the previous variants. Delta variant is almost the sole dominating variant, other than P1 from Brazil. And I worry that the next one could be even worse.
All right. Thank you so much, Dr. Eric, for speaking to us in a very, very worrying situation there in the United States. Well, let's just focus on India numbers now. And India saw a single-day rise of 25,166 COVID cases. That's the lowest in 154 days, taking the tally to 3.22 crore infections. And if we take a look at the number with 88.13 lakh doses of vaccines given in the last 24 hours, India also saw a new single-day vaccination record. There were 437 deaths as well in that 24-hour period. So let's take a look now at India's vaccination numbers. India has so far vaccinated 8.9% of the population, though as I said earlier, absolute numbers are so much higher, 55.5 crore. If we look at the best performing states, well, Kerala has vaccinated 19.9%, Delhi 16.4%, Gujarat 15.3%, Uttarakhand 15.3% as well, and Jammu and Kashmir 12.3% of the population. Well, to talk more about the Indian situation, we're joined by Dr. Lancelot Pinto, a consultant pulmonologist and epidemiologist. Thank you so much, Doctor, for joining us. And, you know, the situation that we're seeing currently in the US is so worrying, and we've also been through our own devastating second wave. But the way the numbers are right now, the way the vaccine coverage is right now, what is your view of what's going to happen ahead? Because there's been so much talk of this possible third wave.
Hi, Gargi. Thank you for having me on the show. I think it's very reassuring that our numbers are low right now, but going by the experiences all over the world, I think complacency is something that we should definitely avoid. This is a great opportunity, a great window that we have to vaccinate as many people as possible as soon as possible. You know, there were concerns at the last time when we were vaccinating that vaccination spots were becoming areas of super spread. And since the background rate of infection right now in the community is so low, this is a great opportunity to vaccinate as rapidly as possible. There almost certainly will be more waves in the future, but whether these waves overwhelm our healthcare system, lead to a lot of hospitalizations, lead to a lot of people dying, will depend upon how good we are at our vaccination strategy.
And it's important that we get more vaccines in our kit. You know, we've been talking about this vaccine, that vaccine coming, and it's important we get more because, you know, the way the world is talking, they're talking about booster doses and, you know, those who are more vulnerable requiring another dose of the vaccine to boost their, you know, protection. So given that, we need to get more vaccines in our kitty.
Absolutely. I mean, our target has to be to get people fully vaccinated as soon as possible. And if we still look at the numbers, it's still a minuscule fraction of the entire country which is fully vaccinated at the moment. There is data that's coming in that immunocompromised individuals, immunosuppressed individuals might need a third dose to mount an effective immune response. And, you know, while we are still struggling with 2 doses, you know, there are countries across the world who are already talking about boosters. So we really need to catch up as soon as possible if we want to win this race.
Right, and the government has spoken that they want to, you know, vaccinate as many people by the end of the year. Now, this whole issue of herd immunity is also changing. Now, they're saying you need 90% people vaccinated to actually, you know, achieve herd immunity, especially in the face of the variants.
So, if you talk about, you know, the R0, the number of individuals that get infected from a virus when the population is naive, the initial alpha variant, the R0 was speculated to be about 3, which meant that, you know, every person who got infected would infect 3 others. So the hypothesis was as long as you got 2 out of those 3 vaccinated, you know, you would keep the transmission rate below 1, which is where you want it. Now with the Delta variant, it's hypothesized that the R0 is somewhere in the range of 7 to 8, which means that every infected individual will infect 7 or 8 other individuals. And if you want to keep the transmission number below 1, you need about 6 of those 7 or 7 of those 8 vaccinated, which is pushing up the numbers to about 90% or so. So I think herd immunity is a very optimistic target, and that shouldn't be our target right now. Our target, rather than reduce transmission, should be to ensure that through vaccination, the individuals who do get infected have a milder course and therefore don't overwhelm the healthcare system. So this is like diseases like influenza. We've accepted it for other infective diseases that transmission will occur. Right. Our target needs to shift at keeping people out of hospitals as much as possible.
And any estimate now about this possible third wave, which everybody says will not be as devastating as the one that we just saw, but there were predictions that we'll see cases rising by the end of August. It might peak in October.
So hopefully the third wave will not be a mega wave across the country, and we might have small clusters which are easier to manage relatively, if we focus all our energies, and I think we're already doing that. We are looking at total test positivity rates and guiding our strategy based on those kinds of metrics rather than have a uniform metric for the entire country. So a city like Mumbai, for example, which has a reasonably high level of vaccination coverage, with a lot of individuals already having antibodies by virtue of past infection, may hopefully suffer a milder third wave than maybe some other spots where background infection rates and vaccination rates are a lot lower. So I think we need to redirect our strategy towards preventing micro clusters rather than thinking of a big third wave, hopefully.
All right. Well, thank you so much, Dr. Pinto, for speaking to us on the program.
Thank you.
Thank you. With that, time for us to slip into a short break. On the other side, frequently asked questions about COVID and vaccines. Time now for our special campaign, Vaccinate India, in partnership with Google, where we bring you questions that many of you have about COVID and about vaccines. Joining us is Dr. Mahesh Lakhe, Consultant Internal Medicine and Infectious Diseases, Columbia Asia Hospital, Pune. Thank you so much, Doctor, for joining us. And one of the questions that people, often look up Google is about effectiveness of COVID vaccines.
Yes. The effectiveness of COVID vaccines, be it ChAdOx1 or mRNA vaccines, it is after the 2 doses, it is around 67% and 88% respectively against the Delta variants. So it is a very good effectiveness against these newer variants as well.
Right, and Doctor, if we talk about effectiveness, this also doesn't mean complete protection. If you could just explain that, because all vaccines provide some amount of immunity, but you have to continue being very careful.
Of course. Any vaccine's effectiveness doesn't mean, or is not directly proportional to the virus neutralizing capacity. Effectiveness is defined in a different manner, but whenever you take any kind of vaccine, it is not going to give you 100% protection against the transmission or getting the virus infection. But of course, it is going to give you a very good protection against the severe disease or hospitalization associated with that. And that is why it is all the more important to remember using mask when you are in crowded places, and keeping a physical distance, washing your hands, and keeping general hygiene is very important.
Right, absolutely. And this other practice of trying to measure immunity, by measuring antibodies and testing, what would you say to that? Anti-spike protein antibody titers, which usually we check after taking the vaccine shots and doses, is not the absolute measure of your immunity against that viral infection, because there is something called as T-cell immunity, or where a body's immunity tries to keep it in its memory, the structure of the viral proteins. Even if your antibody titers are lower or fade away in the course of time, but the memory remains in the immunities, which actually helps to form the antibodies whenever they are required in the future. All right, another question that people often look up is how do mRNA vaccines work? Everybody knows these are the new modern vaccines, Pfizer and Moderna. So if you could tell us just, what's so different about them?
See, mRNA vaccines is a kind of a messenger. When it is injected, it kind of instructs the muscle cells to use them to make the protein piece. Once the protein piece is made, the cell breaks down, and that protein piece, goes and attaches to the another cell. So, and body's immunity tries to, form the antibodies against those proteins which have been, which have been actually transferred from the vaccine, and that is how the immune cells, start activating and start forming the antibodies against those particular proteins. And they are very effective way of forming these kind of antibodies. And of course, once the immunity the protein is formed, the cell bursts out, and that is how it doesn't remain inside the human body or human DNA.
And nothing to do with the DNA, because that's, I think, something fueling vaccine hesitancy in the US.
Understood. So basically, the piece on the surface which is there, it is going to get dislodged. And since the messenger RNA which has been injected from the vaccine is not going to enter into your nucleus. The nucleus is where your DNA is located, and that is why you should not worry that it is going to change any kind of DNA in a human body.
No, absolutely, and get vaccinated as soon as you can. Thank you so much, Doctor, for joining us on the program.
Thank you, Gargi, for calling me.
Bye-bye.